As the oldest and most popular assistive reproductive technology, in vitro fertilization, or IVF, is often the best option for those struggling with infertility. If you're dealing with irreparable tube disease, severe endometriosis, ovulatory dysfunction, or poor semen quality, you might find IVF is the answer you've been looking for in your quest to have a baby. So, what exactly is IVF? Simply put, it's a procedure in which a woman's egg is fertilized by a man's sperm in a laboratory. In vitro means outside the body. The resulting embryos are transferred into the uterus. Of course, there are many steps, procedures, and emotions leading up to the point of transfer. IVF is a carefully orchestrated dance in which you and your IVF care team will work together very closely. I'll take you through a detailed overview of the process so you know just what to expect if you decide IVF is right for you. In a normal menstrual cycle, one egg develops and matures within a fluid-filled sac called a follicle. In an IVF cycle, injectable gonadotropins, purified concentrates of the same hormone your body produces, are administered for about 8 to 12 days to cause multiple eggs and follicles to develop. Around cycle day 3, you'll have your blood drawn every 1 to 3 days to monitor estradiol levels, a form of estrogen. Vaginal ultrasound monitoring of the ovaries will also be used to track follicular growth. Once the ultrasound and estradiol levels show the follicles are ready, you'll be notified that it's time to give yourself the HCG or Lupron injection. The egg retrieval is usually performed 36 hours after the injection. Typically, a transvaginal ultrasound is used to guide a needle biopsy of both ovaries in order to remove the eggs. You won't have to worry about any incisions, and you'll be peacefully sleeping while under anesthesia during the procedure. If you have a partner who is providing sperm, he'll collect a fresh semen specimen on egg retrieval day. You get to go home the day of the procedure, and it's a good idea to stay home, rest, and avoid anything strenuous. The eggs are fertilized shortly after egg retrieval, either by direct incubation next to sperm or with intracytoplasmic sperm injection, also known as ICSI, where individual sperm are placed inside each egg to help the fertilization process. The eggs incubate overnight and will be examined for fertilization over the next few days. Once fertilization occurs, the final step of IVF takes place. The embryo or embryos are gently placed inside your uterus using a soft, fine catheter. You'll be awake during the procedure, and your partner or a friend can keep you company. Any remaining viable embryos will be frozen for potential future use. Frozen embryo transfer is a simpler process since you won't have to go through ovarian stimulation and egg retrieval again. Your pregnancy test will be 10 to 12 days after the embryo transfer. Once we determine the HCG level is rising appropriately, it will be time for your first obstetric ultrasound, where you will get your first peek at your bundle of joy. Very few people experience unexpected outcomes with IVF. However, as with any medical procedure, there are risks. Pregnancy loss is a possibility. The rate of pregnancy loss is approximately the same for IVF pregnancies as it is in the general population. Rare cases of ovarian hyperstimulation syndrome have been reported. Patients with OHSS experience intense pain when their ovaries become overstimulated. Your IVF care team will be with you every step of the way to minimize risks and deal with any issues that might come up. Embarking on an IVF cycle is exciting, complex, and at times stressful. Speak freely with your physician throughout the process. Ask questions. Find out the best way to get ready, both physically and emotionally. Prepare as much as possible to set yourself up for success and make your dream of having a baby come true.